Hi, my name is Dr. Brian Kim, and I'm a cataract surgery specialist here at Professional Eye Associates in Northwest Georgia. Thank you for allowing me the privilege and opportunity to serve you with this life-changing surgery through vision restoration. A little bit about me. I've been at Professional Eye Associates since 2007, and I've performed well over 15,000 cataract surgeries, and I use the latest lens implant technologies, including the toric lens to correct astigmatism, as well as the multifocal lens, trifocal lens, and extended depth of focus lenses to help patients see better without their glasses and contacts. I also perform complex cataract surgeries and have surgeons from all over the country and outside of the country refer me these challenging cases. All of this is to say you're in good hands with me, and rest assured that our experienced and certified staff and I will take great care of you. This video will cover what a cataract is, what to do to prepare for cataract surgery, what to expect during surgery, what to expect after surgery, and so forth. So sit back and relax and enjoy the video.
So what is a cataract? Let's start with a little bit of eye anatomy. This is a natural lens and it's behind the pupil. It's optically clear like looking through a clear glass window. But over time, the lens becomes yellow and cloudy like looking through a stained glass window, like a church. There are many causes of cataracts, such as injury to the eye, diabetes, inflammation, or you can even be born with cataracts. But the most common cause is simply age-related cataracts, which usually forms in our 50s and 60s. Unfortunately, over time, the central part of the cataract becomes more yellow and more dense and cloudy, and this causes worsening vision. So when should you have cataract surgery?
We're excited for you because cataract surgery is one of the most successful and life-changing surgeries in the world. But please keep in mind, you should never feel pressured to have cataract surgery. In other words, if you don't have any vision trouble, then you can wait. But if you begin to have trouble, for example, driving at night, the glare from the car headlights, trouble reading the scroll on the TV news, or trouble with your hobbies or daily tasks because of your vision, then you should consider having surgery, because these problems will only progress and get worse as the cataract gets worse.
This picture was taken from our parking deck using my camera phone and a vision simulation app developed by fellow ophthalmologist Dr. Michael Ullman. And as you can see on this image, it's crystal clear, which shows no cataract. But as the cataract worsens and we change the image on the app, you can see the image becomes more grainy and yellow. And as the cataract progresses over time, the central part of the lens becomes even more yellow and more opaque, and you can see the image becoming more blurry and dark. And this is how cataracts progress slowly and gradually over time, and eventually can make patients lose significant vision, even to the point of blindness. What happens during cataract surgery? Simply speaking, the cloudy lens is contained inside a clear capsular bag similar to a suitcase. In order to get the cataract out, I'll have to open the suitcase and then remove the cataract. But remember, that lens is in your eye to be able to focus your vision. So when you remove that lens, just like a burned out light bulb, you have to replace it with a new lens. And the new lens that you're going to receive is an artificial lens implant. The benefit of the artificial lens implant is that it typically doesn't cloud over, and the cataract never grows back, so you'll never have to have cataract surgery again. It's a permanent surgery. Most patients are extremely happy with their vision after surgery, but there are some patients who might notice a difference between their natural lens and the new artificial lens implant. This is an image from the vision simulator, as if you are looking out of your right eye after surgery. It's not common, but some patients may see a dark outer shadow after surgery, and what they're seeing is the edge of the lens implant, which is called negative dysphotopsia. This happens because, unlike the natural lens, which is big and round, the artificial lens is smaller and flat like a coin, which can cast a dark shadow in your outer vision.
To be clear, most patients don't notice this, but if you do, don't worry. I tell people it's like wearing a new pair of shoes for the first time. At first, you have to break them in, they might not feel comfortable, but then it gets better. Same goes for this negative dysphotopsia. More importantly, all the lens implants are designed the same way, so you really don't have any alternate options. Lastly, in some rare cases in some highly sensitive patients, if they cannot adjust to it, I do have the skills to remove the lens and position it in a slightly different position. However, again, most patients don't need additional surgery and they're very happy with their vision after cataract surgery.
What choices do you have for your lens implant?
Before we discuss this, let's talk about your prescription.
Everyone has a prescription and it's broken down into two general forms. Take a look at this image. The near person is clear, but the far person is blurry. This is called myopia, also called nearsightedness. I prefer to call this near dominant vision because this person sees clearly for close tasks, but has to wear glasses or contacts to see clearly for far tasks, such as driving a car. On the other hand, this image shows the far person is clear, but the near person is blurry, which occurs when someone is presbyopic. When we become 40 to 50 years of age, our natural lens loses flexibility and we start to have trouble seeing for near tasks. These people have to wear either prescription glasses or reading glasses to see clearly for near tasks, such as for reading a book or using their cell phone.
When we place the artificial lens implant inside the capsular bag, we can pick the lens power, which determines the focus of your vision. We have the opportunity to help patients see better without glasses or contacts. And this is exciting because many patients have worn glasses their entire lives, and this is their chance to see better without glasses. But keep in mind, cataract surgery is divided into two major groups: insurance only versus insurance plus. Insurance only covers the removal of the cloudy lens and the replacement with a basic monofocal or one-focus lens implant. The insurance company doesn't guarantee or promise that you'll be able to see without glasses after cataract surgery and assumes that you'll still have to wear glasses after surgery. So please know that I will try my very best to give you the very best vision with what your insurance allows me to do. But if you choose the Insurance Plus option, your insurance will cover the cataract surgery, plus you can pay out of pocket for a special type of lens implant that will allow you to see better without glasses or contacts.
So again, this is a cartoon of a basic monofocal lens which is covered by the insurance, and there's no guarantee or promise that you'll be able to see clearly without glasses or contacts. This lens is called a toric lens. You can see those little hash marks on the lens, and this reduces your astigmatism and allows you to see clearly at a given distance. Now bear in mind, not everyone has astigmatism, and I tell people having astigmatism is like being tall or short, or having a big nose or a small nose, or big feet or small feet. Either you have it or you don't. And because of that, some patients you'll see, they never paid anything extra for cataract surgery, yet they're able to see clearly without glasses, whereas some other patients can't and they have to wear glasses. This is because of this issue. Some people have that astigmatism. Unfortunately, the insurance doesn't cover the toric lens, so for those people who have astigmatism, they have to pay for that in order to see clearly without glasses or contacts. This lens has rings within the lens, and these are either a multifocal, trifocal, or an extended depth of focus lens, and these lenses give you a wider range of vision correction for distance, intermediate, and near, with less dependence on glasses or contacts. We will discuss your specific situation in more detail to help you choose the best option for you. Do cataracts ever grow back?
No, the cataracts never grow back, and this is a permanent surgery. But your vision can get worse months or years later, and something called a posterior capsule opacification can occur. As I said before, the capsular bag is like a suitcase, which holds the lens implant. It's typically clear, like looking through a clear piece of glass. But over time, months or years later, it can become hazy. The capsule bag can become cloudy and blur your vision. It's fairly common for this to happen. Nearly half patients who have this surgery develop a PCO, a posterior capsule opacification, and it can happen despite a perfectly performed surgery. Fortunately, the fix is safe and simple with a laser procedure called a YAG capsulotomy. The laser procedure improves the vision by the next day and permanently fixes this problem. You'll never have to have YAG capsulotomy once you have this done.
What do I do before the surgery?
For those of you who wear contact lenses, it's very important for you to stay out of your contact lenses for 1 straight week before your preoperative evaluation. And this is because the contact lens changes the shape of your cornea because it sits on the cornea. and we need that corneal measurement for the accuracy of your lens implant calculation. And so if that contact changes temporarily the shape of your cornea, it can make your lens implant calculation less accurate. So again, please stay out of your contacts for 1 straight week before your surgery evaluation. But after we do that measurement, you can go ahead and go back into your contact lenses until the day of your surgery. For those of you who've had prior LASIK or PRK, it's very important for you to tell us that you've had these surgeries. It's hard to tell if you've had these surgeries because your corneal examination can appear normal. And if you don't tell us this information, we won't know to make the special adjustments for your lens implant calculation. LASIK and PRK permanently change the shape of the cornea. And that piece of information, as I said about the contact lenses, will affect the accuracy of the lens implant calculation. So if you don't make those adjustments, it might not be the most accurate result. But fortunately, we have lens implant calculation formulas for LASIK and PRK adjustments that will give us better accuracy for your lens implant calculation to give you the best vision result possible.
What else should I do to prepare for cataract surgery?
The biggest concern with cataract surgery, or any surgery for that matter, is infection. Although infection with cataract surgery is extremely rare, it can cause devastating vision loss, including blindness. So we want to take every precaution necessary before the surgery. Believe it or not, the risk for infection doesn't come from the surgery itself. It comes from before the surgery. The source for this infection comes from the eyelid and eyelashes, where the bacteria lives and grows. So 1 week before the surgery, you will have to sanitize the eyelid and eyelashes. First, if you wear eye makeup, you'll have to stop wearing eye makeup 1 week before the surgery. Why? Because the makeup carries bacteria. Second, you'll have to clean the eyelids and eyelashes.
You're going to get a small cup of water with a few drops of baby shampoo, and then you're going to get a disposable makeup remover pad. You're going to dip it in that water every morning 1 week before the surgery, and you're going to clean the eyelid and eyelashes. You're going to close the eyelids, and when you close the eyelids, you're going to scrub the lid and lashes with the soapy water and the baby shampoo. You're going to scrub the lid and lashes back and forth, and you want to put enough friction as if you're brushing your teeth. Enough friction on the eyelid and eyelashes to remove the dead skin, the bacteria, and the oily material and dandruff off the lid and lashes. And then every night before bedtime, 1 week before the surgery, you're going to take a 1/4 inch of that ointment on a clean finger, and you're going to rub that ointment into the lid and lashes at bedtime every night leading up to the surgery. Again, you're going to clean it every morning 1 week before the surgery, every morning, and then the ointment at bedtime every night 1 week before the surgery leading up to the surgery.
A lot of information, I know, but don't worry, you'll receive a written sheet with all of these instructions. And remember, once you do all of these cleansings, once you have surgery, you're going to quit all of that cleansing and you're going to switch to the surgery eye drops. So what about the surgery eye drops options? Well, there are 2 options for you for the medicated surgery eye drops. And you'll start to take those eye drops 1 day before the surgery and continue them for 4 weeks after the surgery.
The first option will be 3 bottles 4 times a day, which is 12 drops a day. You're going to have an antibiotic, which is usually ocufloxacin, a non-steroidal, which we typically use diclofenac, and then the third one, which is a steroid, prednisolone. Now, depending on your pharmacy, the prednisolone may be in either a pink top or a white top. But still, you're going to have these 3 bottles, again, through the pharmacy, through your insurance, and this will be 12 drops a day. The second option is through a compounding pharmacy where they've mixed all the drops together. Instead of 3 bottles 4 times a day, it's just 1 bottle 4 times a day, and this is a lot easier for patients. However, you can't get these drops at your pharmacy. These are special order through us, and if you wanted to get these drops, you can purchase these drops from our office. And you should have enough drops to cover you for the 4 weeks after the surgery.
So what should you expect on the day of the surgery? Well, when you show up for surgery, you'll be with us for about 1 to 2 hours. But again, it only takes about 10 to 15 minutes for me to do the surgery itself. You shouldn't have much pain at all because we'll give you anesthesia sedation to help you stay relaxed. But if you do have pain, please let us know and the anesthesia team will give you more medicine to make you more comfortable. It is a misconception that you're going to be completely put asleep for cataract surgery. We hear this a lot for some patients. To put you to sleep, it would require heavy sedation and a tube down the throat called general anesthesia. And we do not do general anesthesia with cataract surgery. In fact, that's very, very uncommon for this surgery. But rest assured, we're going to give you the appropriate amount of anesthesia to help keep you calm and relaxed without overdosing you with medication. Because remember, if you're overdosed, then you're going to go home really sleepy and you might have a higher risk for falling, which is not good when you have cataract surgery. Once you're done with the surgery, someone will have to drive you home because the anesthesia makes you really drowsy and unsafe to drive. Once you get home, you'll begin the special surgery eye drops. You'll actually start them the day before surgery and again continue them for 4 straight weeks after surgery. We will supply you with a plastic shield to wear when you sleep because you might accidentally rub on your eye while you're sleeping, which can hurt the eye. You will wear this plastic shield to cover your eye when you sleep with a little bit of tape that we're going to supply you with, and you're going to wear that shield when you sleep for 1 week after the surgery.
So this is the plastic medical tape as well as the plastic eye shield. It's a stiff shield. And I've already torn off pieces of tape and I'm laying them hanging on the side of the counter. I'm going to place the plastic shield over the surgical eye, and you can see how it's sticking out on one side. That part goes towards the nose between the eyebrows. And so you have the pointy part again between the nose and the eyebrows, and you're going to place a piece of that tape vertically over the forehead and cheek on the outer side and on the forehead and cheek on the inner side. And this is how you apply the plastic shield that you're going to wear when you sleep after cataract surgery for 1 straight week after surgery.
Cataract surgery is obviously real surgery, and with real surgery, you can have complications. So starting from the front to the back of the eye, you can have damage to the cornea, which is the front surface of the eye, and that can cause swelling and might require further surgery to correct the cornea. You can have damage to the lens capsule itself, the case, the suitcase that holds the lens, and you can have loss of lens material into the back of the eye, and that's called posterior capsule rupture. That risk is fairly low, especially because we do this thousands of times. But when it does happen, the good news is you can typically be able to handle it and salvage the situation. There's also risk for glaucoma when you have high pressure in the eye. This occurs more commonly if you have a risk for glaucoma or if you have a history of glaucoma. But even if you don't, you can develop high eye pressure afterward, which might require eye medicines and also may require more surgery in the future. Damage to the retina can occur in the sense of macular edema, swelling in the macular part of the retinal tissue, and that will require medicines and sometimes further interventions. And then finally, retinal detachment is a pretty devastating complication where you have a retinal detachment after surgery. This is fairly uncommon again because we're working in the front of the eye and interaction with the retina is a very low risk. But again, these are all potential risks whenever you have surgery. And of course, you have to take them very seriously if you're going to have this surgery. The good news is, having done this thousands of times, the risk for those complications are exceedingly low. But like I tell patients, I'm not God, I can't make any of those guarantees. But in my hands, the chances of a complication like that are very low. You'll return for a scheduled checkup either later that day or the next day, depending on your paperwork and your situation. You will then return for a 1 to 2 week follow-up for another check to make sure everything looks good. At any time after surgery, if you experience pain, loss of vision, this could be an emergency and you should call us immediately to come in for a checkup. But if all looks well, the second eye surgery will proceed roughly about 2 weeks after the first eye surgery, and you'll repeat the same process with regards to cleaning the lids and then using the drops and wearing that eye shield when you sleep. Cataract surgery is a safe and life-changing surgery, and again, we are honored and privileged to be able to serve you in this manner. We look forward to taking great care of you.